Okay, Assalamualaikum warahmatullahi wabarakatuh and a good day to all panel. In this session, I will share to all of you about my bachelor degree project 1, which the title is Muscle and Force Analysis of Counterbalance Arm Sling for Exercise for Neurological Hemiparesis Patient. So, before I go through with my presentation, let me introduce myself first. My name is Muhammad Akmar bin Ruslan and my supervisor is Puan HARYATI binti HAMBALI. Now we go to the introduction. According to Watson 2008, hemiplegia is defined as paralysis on one side of the body caused by brain damage, while hemiparesis is weakness or partial paralysis on one side of the body caused by brain damage. Due to the weakness, neurological patients with hemiparesis face trouble to perform daily activities such as dressing, eating, typing, and others. The functionality of surface electromyography (EMG) is used to detect muscle function or muscle activities through electrical stimulation. Consequently, the analysis of muscle of people or patients through EMG was proposed to detect the functionality of an application of current device. For the first picture shows about the effect between left side and right side brain injury, and the second figure shows the tool that I use to analyze the muscle activity, which is electromyography (EMG). So, what is the problem? Hemiparesis patient facing trouble in performing exercise during the therapy session and everyday activities that include eating, dressing, using bathroom, and other activities. The patient with hemiparesis suffer their limitation of range of movement, of range of motion to move their arm in different path and angle. In order to increase in performing of daily life activity, as EMG is reliable tool used to detect the muscle activities. So, major drawback in predicting muscle strength of EMG is that the force produced by the muscle could not calculated with non-invasive and direct. So, we go through to the objective of the project. The objective of this project is number one is to investigate muscle and force activity of normal people and hemiparesis patient with counterbalance arm sling. For the second objective is uh, to evaluate the effect of muscle using surface electromyography (EMG) device. And for the last objective is to evaluate the effectiveness of using counterbalance arm sling to muscle to improvement and time to fatigue for hemiparesis patient. The next we go to scope of the project. Okay, this project analysis will focus into analyze the muscle activity and force analysis with assistive device of neurological hemiparesis patient in Perkeso Rehabilitation Center in Melaka. The scope is first distribute survey form and conduct the interview to the patient at Perkeso. Next, perform muscle testing activity using EMG in order to evaluate the effect of muscle strength to the patient. And lastly, analyze all the results obtained from the survey, interview session, and by using tools, which is EMG. We go to the literature review. Gonzalez et al. 2010 said that humans conceive of upper limb part and the part is important to assist them in daily life activity. EMG, known as a technique of measuring electrical activity that produced by muscle during rest and contraction, and electrical signal generated from the brain and sent to the muscle via motor neuron. Gupta et al. 2017. And according to Johns Hopkins Medicine Health Library 2019, the test is used to help detect neuromuscular abnormalities through the skin into the muscle. Okay. For the methodology, this is the flowchart of my analysis. Okay. The analysis will start with visit to the Perkeso. Then we define the problem statement. After that, collect data with do some observation, survey, or interview, and then continue analysis with screening. Analysis will continue with conduct the pilot test. In pilot test, we do some ways, which is EMG testing and data acquisition. And for the lastly, get the result and do analysis for the EMG for the muscle. This is the flow how to running testing using EMG tools. Firstly, EMG sensor will attach to the normal people and patient. Then run the testing experiment with and without assistive device. Experiment will run experiment with planning activity with time frame, and lastly analyze the result data. Before testing, the preparation of skin need to do in order to improve the adhesion of the electrode. There is several ways how to clean the skin, which is use the special abrasive to remove that skin, or you can use the sandpaper with soft controller. And for the expected result, I have shortlisted some of the muscle involved as shown in the table. The picture at the top shows that the counterbalance arm sling device. This device used to assist daily activities of the patient that suffer from disability which affect physical movement. And for the two picture at the bottom shows the part of muscle involved for our experiment. So I think that's all from me, and I hope I had delivered my presentation clearly and able to all my panel clear about my project. Assalamualaikum warahmatullahi wabarakatuh and have a good day. Thank you.